let's talk about blood supply of chest wall. As you know, in the previous lectures in the class we done with the chest wall. The chest wall having two parts, anterior chest wall and posterior chest wall. Anterior chest wall and posterior chest wall. The arteries present between the ribs, arteries named intercostal arteries. Intercostal arteries. The arteries, the two group because the two wall, anterior chest wall and posterior chest wall. Intercostal arteries, the group anterior intercostal arteries. Anterior intercostal arteries. And second group, posterior intercostal arteries. Posterior intercostal arteries. Anterior intercostal artery, posterior intercostal artery. Anterior intercostal arteries. Anterior intercostal arteries. Mostly the anterior intercostal artery, the anterior chest supply anterior intercostal supplied by anterior intercostal artery, posterior chest supplied by posterior intercostal arteries. The anterior chest, the anterior intercostal artery, these are the branches of internal thoracic artery. Internal thoracic artery. Internal thoracic artery is a branch of subclavian artery. Subclavian artery give internal thoracic. Internal thoracic artery give branches, small branches for anterior chest. Mean anterior chest supply by subclavian artery. Subclavian artery give branch internal thoracic artery. Internal thoracic artery supply anterior chest. And the posterior chest supply by having two spaces here, the total 11 spaces, 12 ribs, 11 spaces there, intercostal spaces there. The first two intercostal spaces they having posterior intercostal artery. The first two these branches come from subclavian, artery, and remaining 9 arteries, 9 posterior intercostal artery, 9 posterior intercostal arteries. These are the branches of aorta. It means posterior chest wall main supply by aorta, anterior chest wall supply by subclavian artery. Subclavian artery give branch internal thoracic then giving branches anterior intercostal arteries. The posterior chest wall supplied by posterior intercostal arteries. This posterior intercostal artery total 11 in number. Here you can see is a posterior chest wall. In the center is a vertebra. The vertebra attached with ribs. Both sides we having ribs here, and the spaces we can count are 12 ribs there. There are 11 intercostal spaces there. 11 intercostal spaces there. And here we having this anterior chest wall. In center we having sternum, and sternum attached with rib number 1, 2, 3, 4, 5, 6, 7. 7 till 7th rib, from 1 to 7 directly attached, or these are true rib, and remaining indirectly attached is a false rib. And the two ribs they're not attached with sternum directly or indirectly, they're known as floating ribs. This is the anterior chest wall. This anterior chest wall supplied by Subclavian artery is a branch of subclavian. Here I draw the branches here. It's a heart. Heart give arch of aorta. Arch of aorta and descending aorta. Descending aorta, before this aorta going to abdomen, or as a diaphragm. This muscle is diaphragm. It's the arch of aorta. It's the arch of aorta. It's a descending aorta. It's ascending aorta. The descending aorta giving branches here, small branches. These branches going for posterior intercostal spaces. These are the posterior intercostal artery. 1, 2, 3, 4, 5, 6, 7, 8, 9. These 9 pairs, on right side also, on left side also. 1 to 9. This 1 to 9 actually start from second space. Second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, and 11th, last one. The 9 posterior intercostals, posterior intercostal artery. The 9 pairs. How many? 9 pairs on both sides. An arch of aorta giving branch here. Left subclavian artery this side. It's a left subclavian artery. This side we having bucocephalic trunk. Right carotid artery, common carotid. Left common carotid going up to head and neck. It's a subclavian artery. Subclavian artery giving branches before change to axillary. Before change to axillary is giving further branches. Okay. In the chest, I draw a different color. In the chest is given one branch here. Is the internal thoracic artery. Internal thoracic artery. This internal thoracic artery is a branch of, is a subclavian artery here. Subclavian artery. This artery is subclavian artery. This internal is internal thoracic artery. This internal thoracic artery first give 6 branches. 1, 2, 3, 4, 5, 6. And these 6 arteries going to anterior chest wall. These are the 6 anterior intercostal arteries. 6 anterior intercostal artery directly come, and then this artery going down to diaphragm and divide to 2. Divide to 2. This artery moving to center part of abdomen. Downside we having, downside here we having abdomen. Downside having abdomen, above we having chest. This level is a diaphragm here. It's a diaphragm here. This artery now entered to abdomen. This artery known as superficial is a epigastric artery. It's a epigastric. It's the epigastric artery. This epigastric artery supply the muscle anterior wall of abdomen. This epigastric artery moving down. And one artery, this artery moving this way, supplied diaphragm. This artery is a musculophrenic artery. Change to 2 branches here. One epigastric, one musculophrenic. This is a phrenic word for diaphragm. This is a musculophrenic artery. Musculophrenic artery they give branches or give to diaphragm, give supply to diaphragm. Give supply to diaphragm. This musculophrenic artery change to give supply to diaphragm, and the artery going to diaphragm is superior phrenic artery. Superior phrenic artery. The artery going for diaphragm. And the musculophrenic artery again moving toward the ribs. Artery number 1, artery number 2, artery number 3, artery number 4, and our last artery number 5. And these 5 arteries, the remaining 5 anterior intercostal arteries. 5 anterior intercostal. Now 11 complete. The first 6 directly come from what this artery? Internal thoracic artery. Internal thoracic artery. Okay, I just write a short form here. Internal thoracic artery. This internal thoracic artery is moving down. This internal thoracic artery is a branch of, you can see here, it's a branch of subclavian artery. This artery is going down, and before also going down before it change to 2, it gives 6 direct branches here. 6 anterior. I'm supplying here anterior chest. It's a blood supply for anterior chest. Blood supply for anterior chest. On this side of the diagram, I am talking about the blood supply for is the posterior chest wall. It's the posterior chest. That side is anterior chest arteries. Okay, anterior intercostal arteries, and these are posterior intercostal arteries. Posterior intercostal arteries, these 9 pairs of descending aorta. These are the branches of descending aorta, right side and left side both. Branches of descending aorta. The subclavian artery also present on this side. The subclavian artery enter to axilla, change to axillary, before change to axillary. Here give branch here. Internal thoracic artery. This internal thoracic artery give first 6 branches, 1, 2, 3, 4, 5 and 6. Then this artery change to 2. This artery change to 2. This artery change to 2. One is epigastric artery. Oh, this is on the left side, this is on the right side. Epigastric artery moving to abdomen. And one artery, musculophrenic artery. Musculophrenic artery. This musculophrenic artery again giving 1, 2, 3, 4, 5. The 5 anterior intercostal arteries, and give branch to diaphragm also. It's a superior phrenic artery. Internal thoracic artery change to 2. Number 1 here is the epigastric, this one. Number 2 here, musculophrenic artery. This musculophrenic artery first giving branches, short branches, 1, 2, 3, 4, 5. These 5 anterior intercostal. The 6 already done. Okay. Internal thoracic already give. Internal thoracic artery already gives 6 branches here. These are 6 anterior intercostal arteries. 6 anterior intercostal arteries, and the 5 here. Now 11 complete. The musculophrenic artery, the one half of this artery, this half give branch to diaphragm, and that artery name is phrenic artery. And this artery is superior, complete name superior phrenic artery. And the second half, musculophrenic artery, the second half give the remaining branches of anterior intercostal arteries. Now you can see here the symmetry on the both sides, right side, left side. Right subclavian, left subclavian give first internal thoracic. Then this side, right side, anterior intercostal artery directly come. It means anterior intercostal artery, the blood supply internal thoracic artery. It's internal thoracic artery. Internal thoracic artery, half of chest, anterior chest directly supplied, then indirectly with the musculophrenic artery supply remaining part of the chest. Remaining part of anterior chest is the blood supply of anterior chest. The blood supply of anterior chest is internal thoracic artery. Internal thoracic artery, internal thoracic artery. This come from subclavian artery. Internal thoracic artery giving branches directly to anterior chest, and then change to musculophrenic artery and epigastric artery. Epigastric artery moving to abdomen, and musculophrenic artery give further branches to anterior chest. These are same. First arteries, anterior intercostal arteries, then this artery changed to epigastric artery, and this is a musculophrenic artery. Musculophrenic artery supply remaining spaces, anterior intercostal spaces, and the aorta exactly present anterior to vertebra, and this aorta, the arch of aorta is not above the sternal angle. The sternal angle at the level of the second vertebra, sternal angle level of the second rib. The first two spaces not supplied by aorta. The aorta give branch to this one, to this one, to this one, to this one, both side. These are the 9 pairs of posterior intercostal artery. The first two spaces not supplied by this. The first two spaces, posterior intercostal arteries, the subclavian artery give one branch, costocervical trunk. This is a subclavian artery give branch costocervical trunk. In the costocervical trunk giving 1 and 2. Costocervical trunk giving 2 posterior intercostal. Number 1 posterior intercostal, number 2 posterior intercostal. And lower 9 posterior intercostal arteries, direct branches of descending aorta. The costocervical trunk. This costocervical trunk give branch, 2 branches. This is for ribs. First posterior intercostal, second posterior intercostal, then third posterior intercostal, fourth posterior intercostal, fifth one, sixth one, 7, 8, 9, 10, 11. So the remaining nine come from descending aorta. It's a very important MCQ for examination point of view. The posterior intercostal, the first and second posterior intercostal space supplied by subclavian artery, branches of subclavian artery. In general, if we talk about the general, here you can see the summary here. Anterior intercostal artery come from internal thoracic, and posterior intercostal artery main part branches of aorta, but the first two branches come from subclavian artery. This is about the arterial supply of the anterior chest as well as posterior chest.